My name is Dr. Umair, and I'm going to talk about all the causes of bleeding during defecation, or you can say when you are going to washroom and you have seen bleeding on a toilet. So I'm going to discuss all those reasons which can cause these things, and let's dig in. The first, if the bleeding is painless, usually painless bleeding is the first sign of hemorrhoid, and most likely you do have a hemorrhoid. Hemorrhoids are basically piles, so you can say the dilated anal cushions. These are small cushions which are present in your anal canal, which help facilitating during passage of stool, but due to some reasons it can dilate, or you can say swell up, and it can cause bleeding sometimes. It is usually painless, and usually people do complain about feeling something coming out of their anal canal. So it's most likely a hemorrhoid. The second is a painful cause of bleeding. If you went to for a toilet, or you can say take a dump or defecation, you will feel that tearing force, or you can say passing a knife. People do describe it like that I have been having so painful defecation that some needle or blade is passing through my anal canal. So this is most likely a cause of fissure. It is a painful fresh bleeding. Okay, if you have a painless fresh bleeding, it's most likely due to hemorrhoids. If you have a bleeding which is very painful during defecation, and you do try to hesitate at defecation, then it's most likely a fissure. Second is the bleeding, but it's not a fresh blood bleeding. It's a sort of pus mixed with blood. It's a serous angina, or you can say blood mixed stained sort of discharge which is coming from your anal canal, and it's most likely coming in a fistula. Fistula is basically a separate tract which has formed due to any sort of abscess or any other problem in your perianal area, and it's most likely communicating between your anal canal and your skin. So if you have a painful bleeding, most likely it's fissure. If you have a painless bleeding, most likely it's a hemorrhoid. And if you do not have a clear bleeding but blood stained is discharge, most likely it's a fistula. Most of the anal pathologies do revolve around these three diseases. So I hope you find this video helpful, and for any other questions you can comment down below. This is Dr. Matt signing off. Allah Hafiz.